Hello, my name is Dr. Vaibhav Keskar. I'm a senior consultant nephrologist in Fortis Hospital, Mulund. Today I'll be talking a bit about an investigation called kidney biopsy. A kidney biopsy is an investigation that your nephrologist may ask for. Kidney biopsy is a procedure where a small tissue sample of kidney is taken out with a needle while doing sonography, and it's sent for examination, pathologic examination. So the pathologist will examine that tissue under microscope and give us the diagnosis. So who needs a kidney biopsy? So there are several patients who have kidney issue where we can diagnose the problem with blood and urine tests. However, in certain patients, we do need something called as tissue diagnosis. We want to see what is happening at the tissue level. What is the structural problem in the kidney filters? So typically these patients are patients who have proteins or blood in their urine. We call this as proteinuria or hematuria. These diseases mostly happen in all the ages, but many times they are seen in young adults. In children, when they present as nephrotic syndrome. In young adults, we call these syndromes as nephrotic or nephritic syndrome. We can see these disorders in elderly as well. When we come across a patient who has protein or blood in urine, and we test the blood and urine for specific disorders, some of these patients do need kidney biopsy. This biopsy is a daycare procedure typically. So it's fairly common and routine procedure. However, there are certain risks involved. Your doctor will talk to you about the risks and benefits, but in many cases, benefits are more than risks. That's why the procedure is conducted. The risk basically is because of risk of bleeding, and the risk is not that common. 1 in 100 patients do experience some bleeding, but it is very rare to have severe bleeding requiring some intervention. You will be asked to wait in the hospital for a few hours and maybe a day just to make sure that there are no complications. However, after that, after going home, you can continue your daily routine activities after having a kidney biopsy. It hardly ever happens that kidney biopsy done at one point of time will have very long-term consequences. So it's a relatively safe procedure. So if there are risks involved, then why do such an invasive procedure? Because the insights that we get from kidney biopsy, by looking at the actual filters of the kidney, tissue of the kidney, is invaluable. It helps us diagnose certain conditions, for example, IgA nephropathy, membranous nephropathy, FSGS or minimal change disease, or certain aggressive disorders like lupus nephritis. So this diagnostic information is invaluable. With this information, we can decide the treatment. Also, we can use this information to prognosticate. That means to consider long-term outcome. So in all, this is a very useful tool when we come across such kind of patients. Some of the kidney transplant patients also need kidney biopsy. The procedure is slightly different, but the principles are the same. We typically use this procedure to diagnose rejection, presence of certain infections, and in certain cases, if the native kidney disease is coming again in the transplanted kidney.